Check accuracy and completeness of each MAR with healthcare provider's medication order. Check patient's name and medication name, dosage, route, which sinus, and time of administration. Clarify incomplete or unclear orders with healthcare provider before administration. Review patient information related to medication, including action, purpose, normal dose and route, side effects, time of onset, and peak action, and nursing implications. Assess patient's medical history, example, hypertension, heart disease, diabetes, and hyperthyroidism. Medication history and history of allergies. List medication allergies on each page of the MAR and prominently display any allergies on the patient's medical record per agency policy. When patient has allergy, provide allergy bracelet. Assess patients' or family caregivers' knowledge, experience, and health literacy. Perform hand hygiene using a pen light. Inspect condition of nose and sinuses. Palpate sinuses for pain or tenderness. Note type of drainage if present. Good day, ma'am. Siya ni Hana May Centeno, di student nurse mo tatangaal daw. Tumagok man, ma'am, na niya tinagan mo.
Siya ni Lorraine Joy Calsamon.
Kat no ti birthday, ma'am?
January 4, 1997.
Okay. Tatagaron, ma'am, i-check ko man day taagong mo, no? Adda man ti problema na. Assess patient's knowledge, prior experience with the use of nasal instillation and technique for installation, and feelings about the procedure. Magik man, ma'am, no adaba ti among when no napadpadasa mo, ti ma-check ti agong na.
Haan pa yun.
Anya garo ti marikrig ng tata, ma'am.
Nasakit dito ako kung umaga sa nakabarado as well.
Itamag ko man galod, ma'am, no adaba history iti allergy,
Adda man.
iti makmakan no ag-agas, ma'am.
Adda man.
Namagak man, ma'am, no anya agi di nga agas man pa.
Antibiotic ni naitulog di malpas na nagana.
Adapay baka di, ma'am.
Awan matin.
Assess patient's goals or preferences for how skill is to be performed or what patient expects. Perform hand hygiene, collect appropriate equipment, and MAR. Prepare medications for installation. Attend to procedure to avoid distractions. Check label of medication against MAR 2 times. Preparation usually involves checking label when removing nasal drops or sprays out of storage and before leaving preparation area. Check expiration date on container. These are the first and second checks for accuracy. Perform hand hygiene. Take medications to patient at correct time per agency policy. Consider whether medication is time critical. During administration, apply 7 rights of medication administration. Identify patient using 2 identifiers, example, name and birthday, or name and medical record number, according to agency policy. Compare identifiers with information on patient's MAR or medical record. at patient's bedside. Again, compare an MAR or computer printout with names of medication on medication labels and patient name. Ask patient about any allergies. This is the third accuracy check. Explain procedure to patient and sensation to expect. Discuss purpose of each medication, action, and possible adverse effects. Allow patient to ask any questions about medications. Patients who self-instill medications may be allowed to give drops under nurses' supervision, per agency policy. Tell patients receiving nasal instillation that they may experience burning or stinging on mucosa or choking sensation as medication trickles into throat. Arrange supplies and medications at bedside, perform hand hygiene, and apply clean gloves. Gently roll or shake container, instruct patient to cliff or blow nose gently unless contraindicated. Example, risk of increase intracranial pressure or nosebleeds. Administer nasal drops. Help patient to supine position and position head properly. Mga magsimpa tayo mga pay basit. Namimete position tayo. Diretso mga. For access to posterior pharynx, tilt patient's head backward. Mata na mga pay basit na.
Okay.
For access to ethmoid or sphenoid sinus, tilt head back over edge of bed or place a small pillow under patient's shoulder and tilt head back. For access to frontal and maxillary sinus, tilt head back over edge of bed or pillow with head turned toward side to be treated. For access to posterior pharynx, tilt patient's head backward. For access to ethmoid or sphenoid sinus, tilt head back over edge of bed or place a small pillow under patient's shoulder and tilt head back. For access to frontal and maxillary sinus, tilt head back over edge of bed or pillow with head turned toward side to be treated. Support patient's head with non-dominant hand. Instruct patient to breathe through mouth. Hold dropper 1 cm above ears and instill prescribed number of drops toward midline of ethmoid bone. Have patient remain in supine position 5 minutes. Offer facial tissue to blot runny nose, but caution patient against blowing nose for several minutes.